Thank you very much. Good afternoon. Come on, you can do better than that. Good afternoon. I know you just ate lunch and you're dragging a little bit. I was over at Woodburn with our leadership lunch and we had chicken and dumplings. Oh boy, but talk about a meal that puts you to sleep about 3 o'clock in the afternoon. I am so happy and excited to be here with you. In years past, I was a member of the Cancer Consortium for a number of years, and I chaired the Disparity Subcommittee, which was an important part of our work. And every year we would have this planning retreat, and it was really so important for the work that we did. I guess if you serve long enough, I've been in public service now for 30 years, and I can't think of many initiatives that I've been part of where we've seen the kind of results, real results, as we have here with the work of the Cancer Consortium. I remember like it was almost yesterday when it was started back in the early 2001, 2002, 15 or 16 years ago. I got a call from my friend Bill Bowser. And Bill had a son with leukemia, got great treatment, survived and fought through it. And he had gotten a call from Governor Minner, who was asking if he would chair the consortium. Bill's a lawyer, not a scientist, not a public health expert, but he was committed. He was committed to the cause because of his personal experience. And he called me up and he said, John, he said, is the governor serious about this? And I paused for a minute. It felt like a trick question. I said, what do you mean, is the governor serious? He said, is the governor really going to put effort and energy and money behind this initiative? Not wanting to speak for the governor, I said, well, why don't you give her a call? Call her up yourself. And he did. And shortly thereafter, he became the chair of the commission. And he must have gotten the right answer, because in the subsequent years, the Cancer Consortium was funded. We had, how about all the members? Are the members here? Members of the consortium, stand up, because I understand we have some members and then we have public folks, all the members. I see Dr. Patel. Oh, thank you. How about a round of applause for these? So the Cancer Consortium has done incredible work and has moved the needle in a big way. And part of the reason is because we got tremendous advice and participation by our medical community, represented here today. And they provided the direction, science-based direction. But ultimately, it was about those individual faces that you saw on the screen today, which was the motivation that I think gave it so much energy. And we moved the needle. When I first got in public service in the late 80s and 1990s, we used to wring our hands about our high cancer rates in the state of Delaware. We were like in the top 5 among states, worst. And if you talk to anybody here, they tell you, well, yeah, that's the history of our state. You know, we're a chemical center here in Delaware with all the various chemical companies that we had. So it had to be something in the water we drink and the air we breathe. And our challenge was that it wasn't so much the cancer incidence rates that we had. They were about on par with the rest of the country. It was our mortality rates, meaning that people that got cancer in Delaware were dying at greater rates than in other places in our country. And as I said, we were the top 5 worst. Now we're out of the top 10. I don't know, we're 15 or where we are, Dr. Petrelli. We're 18. We're trying to get out of the top 20. And importantly, so the science-based advice was focus on the low-hanging fruit. Focus on the areas and the cancers where you can really make a difference. And we focused on colorectal cancer, and we focused on screening everybody and making sure that no population in our state had a different cancer screening rate than the total population. We're the only state in the country, I believe, that has eliminated the screening gap between the African American population and the general population here in the state of Delaware. And our screening rates are among the highest in the country, if not the highest, in the mid 74 or 5%. That commitment, that involvement, and all the people in the consortium and all the external partners, the money that was put behind it, made a big difference. And guess what? It saves lives. And so I'm here. 2 weeks ago, I love the name of this, I went to the Delaware Poultry Industry Dinner. And it's called Delaware, we got chickens here in Delaware. Did you know that? Lots of them. And poultry industry is king in our state. So in Salisbury, they have the Poultry Industry Booster Banquet. And I was there as the poultry industry booster. And I'm here today as a cancer control booster, a cancer consortium booster for the work that you are doing, the important work that you're doing. We've had those successes. I think the challenge for us now, and there's some indication of what direction you're going to go, is what do we focus on next? I know we wrestled for a number of years when Dr. Grubbs was here working on the committee about what we should do with lung cancer. And should we encourage additional testing to try to save people's lives? And I know the medical team in the consortium came up with a profile, a procedure to address lung cancer in our state. And we also thought long and hard, as they're doing across our country, in how to address prostate cancer in men, particularly African American men, where the prostate incidence and mortality rates are 2.5 times what they are in the general population. And we've struggled with some of those issues, frankly. But the idea of focusing on physical activity is a really good one. And I couldn't be more excited, right, Mary Ann Carter? We need to get behind physical activity in our state, not just for cancer control, but for heart and lung disease and general health as well. I remember back in about 2000, 2001, when I was newly elected as a lieutenant governor, I went to a conference, and the speaker was a physician from Houston, Texas, and he was a cardiothoracic surgeon. And he talked about all the money, all the effort, everything that went into his education and his training as a surgeon. And he said he woke up one day and realized that 90% of the work that he did and the money that was spent on that work was for conditions that were preventable, completely preventable. And one way to do that prevention is to encourage people to eat a healthy diet and get regular physical activity. Let me tell you, that's not easy to do. We've tried that. We worked hard at it. I worked for 8 years on the Lieutenant Governor's Challenge, trying to encourage young people, mostly was where we had most of our success. Because we're fighting trends in the society at large that are running full bore right in our face. Hard to do. I was out at an elementary school in the Red Clay School District during that time when encouraging the kids to eat a healthy diet. And I had been challenged at a speaking event where I said that we need to do a better job with our school lunches. And afterwards, one of my friends came up to me and said, "Governor, you're wrong about the school lunches. We got great school lunches out here at the school. I'm retired now, and I work in the cafeteria." He said, "You got to come out and see it." So I did. Put on my little hat, my gloves, and I was behind the thing serving and I decided they had these little peanut butter and jelly packets. And they had pizza, and they had green beans. And I said, "I'm going to take the green beans." And the kids were coming through, and I'd ask them, would you like some green beans? And everybody, dutifully, they knew the right answer. Green beans, green beans, green beans. All the way through. Afterwards, I went out to talk to the kids about how important it was to eat a healthy diet. And I'm looking around the room. All I could see is little piles of green beans. They knew the right answer. But they didn't eat many green beans that day. You can lead a horse to water, but you can't make him drink. And the physical activity is equally challenging, particularly given our sedentary culture with, iPhones and all the entertainment that we get on little devices. And the way things has changed. When I was a kid in Claymont, everybody walked to school. In fact, you could not get a bus if you lived closer than 1.5 miles. You couldn't get a bus. They wouldn't bus you. At least the school I went to. So we walked. We rode our bike. Now, I understand it's different today. I'm not sure that it always has to be. But we need, as a group, and we can do it. Finally, this is my final message. We can do it. If you can do it anywhere, we ought to be able to do it in Delaware. We proved we could do it with colorectal screenings. How hard a sell do you think that is? Seriously. Think about it. That's a little bit of an uncomfortable conversation. Have you had your colonoscopy? One of the things that we did when I was lieutenant governor, to everybody on their 50th birthday, I was in church one Sunday, and the priest was doing his sermon, and he announced to the congregation that he'd just turned 50 and he had just gotten a birthday card from the lieutenant governor reminding him to get his colonoscopy. That's the length that we went to get our screening rates up. But if we can do it for colorectal screening, we can do it to get our kids and young people and adults more physically active. And I want to just encourage you to do that, encourage the tremendous work that this group has done. I understand we have physical education teachers in the room. All the physical education teachers in the room, stand up, or anybody involved in physical activity and physical education. All right, now. We need you. We're relying on you. We're going to help you. But we got to work together. We can do it in Delaware. What do you think is the most physically active state in the country? Colorado. We can beat Colorado. Come on. We can beat Colorado. Okay, they got mountains. They got, all that kind of nice, so many sunny days a year, twice as many as we do. But we can beat them. We can beat them because we have an unbelievable tradition in our state of working together. Right? That's our greatest asset. And we should always remember that. I'm going to be a physical education booster working with all of you. Thank you much. God bless.